delusions are of two types: delusions that are part of a psychiatric illness, and delusions which a lot of normal, healthy people have. Somebody who is coming to me for diarrhea or asthma or some cancer, some tumor, some migraine headaches, even these people can have false persistent beliefs which are not related directly to their somatic illness. Even relatively healthy people can have false beliefs, strong false beliefs about certain things. So these are also delusions. But then there are delusions in psychiatric patients, patients which have schizophrenia, OCD, bipolar disorder, and delusions have been found to occur in the context of many pathological states, both general, physical, and mental, and are of particular diagnostic importance in psychotic disorders, including schizophrenia, paraphrenia, manic episodes of bipolar disorder, and psychotic depression. So these are some examples where we are going to see delusions: schizophrenia, paraphrenia, manic episodes of bipolar disorder, and psychotic depression, and obviously OCD also. So this is what we are going to see. We are going to see psychiatric patients where the delusions and hallucinations are often common symptoms, and in patients who do not have those psychiatric illnesses and yet they have some delusion or illusion or hallucination, in such cases delusions are more characteristic. In schizophrenia, if you are getting delusions or hallucinations; in OCD, if you are getting illusions or delusions; in bipolar disorder, you are getting illusions or delusions. These are common symptoms. These are often common symptoms. But if in healthy people, if in people with somatic illness, in people with mental illnesses, which are not directly related to psychosis, when you find rubrics related to delusion, they are much more characteristic. Now, in homeopathy, we often say that we have to take only the characteristic symptoms. We need to focus on the characteristic symptoms. Does that mean we ignore the symptoms of delusions and illusions in cases of schizophrenia? Again, a question to all of you. Should we ignore symptoms of delusions, illusions, hallucinations in cases of schizophrenia or OCD? Now, that would depend. There is no definite answer to this. There is no definite no, and there is no definite yes. Why I am saying this? Because a symptom does not become characteristic just because it is rare or peculiar, or it is uncommon. Now, most symptoms which are uncommon, rare, or peculiar, they are characteristic. We know that. But even common symptoms can become characteristic. Can anybody tell me, any of you tell me, when does a common symptom become characteristic? When do you consider a common symptom as a characteristic symptom? Anybody? Come on.